Hi everyone, my name is Marianne Aubin. I'm a PhD candidate at Cornell Tech in our information science department, and I'm so excited today to be presenting joint work with Ting-Wei Chiang, Quere, Levy, and more Naaman. We think in this work of COVID-19 as a sustained information crisis. And it was quite unique in its nature in terms of how long-term the pandemic lasted and how global it really was, and the large impact that it had on many societies. The other thing that was unique about this pandemic is that it happened in a information ecosystem that led to an infodemic, where you had not just the pandemic that was spreading between people very rapidly, but also a lot of misinformation that was being distributed and that was spreading very quickly. And the population that we focus on in this study is that of essential workers, which very quickly emerged as such a key population to keep society running and functional during this time of need. And of course, many papers have emerged since then that have stated that essential workers are likely to be part of underserved populations and that they were placed under immense strain, not just physically, because they had to go into work and potentially be exposed to COVID-19, but also mentally, because so many people were relying on them to do these vital job functions. And so informed behaviors of essential workers really were key to global health as they kept themselves and thus also their communities safe. What we are interested in this study was identifying the interplay between these two aspects of life in a pandemic. This is a US-based study, so we ask the question, how did US-based essential workers manage a contested information landscape in the early months of COVID-19? We use mostly qualitative methods to answer this, so we conducted 14 semi-structured remote interviews, and we defined essential workers very broadly as anyone who self-described as having physically gone into work for the duration of the pandemic. These interviews were all conducted between May and June 2020, so certainly after the pandemic was having a large impact on most people's lives, but we were not yet at the stage where we knew anything about the vaccine, and there were many unknowns still about the spread of the pandemic. Finally, we qualitatively coded interviews and analyzed themes and information needs. I want to highlight the participants that shared their stories with us, and I'd like you to pay particular attention to the range of occupations that we see here. So we certainly have more of the frontline workers, the emergency responders, and healthcare workers, for example, but we also see a larger range of occupations. In terms of findings, we identified 3 key essential worker information needs. First, the need to fulfill job requirements. Second, the need to assess personal risk. And third, the need to keep up with crisis news coverage. And each of these requires a specific information, which is sometimes provided within the workplace and sometimes sought outside the workplace. In order to fulfill job requirements, companies had to communicate protocol changes to employees. And so our participants reported that often companies did so through using existing channels and adapting them. Some people also reported that their job actually requires them to get additional COVID-19 information as a requirement for work. So most people were just getting protocol information about things like mask wearing, sanitizing, or social distancing, but some people were actually kept informed every day at work of things like local case counts or any updates in the law because it was required for their job. Lastly, we saw that people additionally had to convey COVID-19 information to others because they had to enforce COVID-19 protocols. So for example, the flight attendant here says, "We inform, we don't enforce." But with the pandemic, there's a change in the directive where you kind of have to enforce. The second information need we observed was the need to assess personal risk. So, of course, employees were gauging their own risk of contracting COVID-19 at work through looking at things like company emails about policies and protocols to protect employees, but they would also look for information outside of work about how at risk they were on any given day. Employees also assessed financial risk in terms of seeking information about whether there would be layoffs at their company or if their hours were going to be reduced. One grocery store employee that I talked with said, if I see the numbers start to spike in my area, I might decide not to go to work. So she would check the local case counts to understand how at risk she was on that day. The last information need that we identified was the need to keep up with crisis news coverage. They had to deal with the infodemic, where there was so much information out there, much of it not fact-checked and much of it difficult to verify. But they felt the need to keep up with crisis news because they were continually exposed to COVID-19 at work. In many cases, this led to information overload, stress, and anxiety. And 3 of the participants we interviewed experienced this very acutely, where they felt that because they were trying to keep up with the news so much, this was really taking a toll on their mental health. And one participant even reported having a panic attack and going to the doctor and being prescribed not to look at the news anymore. And this kind of goes to the last point, which is that many participants developed coping strategies for managing information intake over time. Some people would completely start to avoid the news. Others would focus only on news in their local area about COVID-19, and yet others tried to focus on the data because they felt that anything else was likely to have a political slant to it. So, for example, the nonprofit worker that I spoke with, her community struggled during this time and needed increased help, which she sought out by looking at local news. And so she said, I'm up at 4:30 in the morning looking at news. It's just a constant 24/7 stream since it started. So that gives you an idea of the types of pressure that these workers were under. Finally, in terms of implications, we did develop this framework for information needs of essential workers during a sustained crisis, and you can find that in our paper. Workers also seek additional crisis information outside of that provided by their workplace is one of the things that we found. And we saw that this could really impact mental health, especially as they have to keep subjecting themselves to exposure at work. We also find some evidence to support that workplace communications can make crisis information management easier or harder. So in some cases, if people were getting additional COVID-19 information at work, that could help them manage the infodemic. And in other cases, if they were not provided with adequate information, that could make them seek out more information outside of the workplace. And this in turn could have an impact on their mental health. So at this point, I'd like to thank all of you for your attention, invite any questions, and lastly, I do want to offer particular thanks to our participants for sharing their stories.